Going on to the next question, question number 2. What do you think will be the answer to this one? See, first of all, learn the MCQ skills that when you are given long stem questions, which majority of the questions in your exam are now long stem, start reading the question from the last line. See, whenever you move to a question, maybe in your grand test or even in your final exam, first look at the options, because from the options you get an idea that this is related to what system, what subject. So carotid pulse, Cannon waves, jugular venous pulse. So I know that this is something related to cardiology, right? Next, what I will do is read the last line. Which of the following additional findings of on examination of neck is most consistent with these findings? The last line is not telling me anything. So in that case, then I will read the second last line. The onset of symptoms was preceded by episode of prolonged substernal chest pain. When it is given substernal chest pain, you start thinking of angina, right? Now, still I'm not able to solve, then I will go and read the question from the first, that is orthopnea, dyspnea, edema which is there, plus which was preceded by this, angina which is there. So what is this question basically? Yes, Akash, correct. If they ask you outside mean plus minus 2 standard deviation, then it will be 5%. Right, so in that case, it's going to be less than 5,500 and more than 9,500. Then it will be total will be 5%. So tell me, what is the diagnosis here in this case, guys? So when there's orthopnea, right, there is pedal edema, edema of the lower extremities, like then there was the substernal chest pain, angina, MI, which is there. So what are you thinking of? What is the diagnosis in this case that you are thinking of? Very good, Dipanshu. Absolutely right. So basically, you are thinking of heart failure. This is a patient of acute heart failure with pedal edema being there. You think of right heart failure, left heart failure. This is right-sided heart failure because there's going to be pedal edema in right-sided heart failure. When there is left-sided heart failure, what edema do you get in left-sided heart failure? So when there's left heart failure, left ventricle failing, giving back pressure to the left atrium, giving back pressure to the pulmonary veins, that is lung, in that case, it is going to be pulmonary edema is going to be present, right? So pulmonary edema is going to be present in left heart failure, pedal edema, hepatomegaly, right? And so basically from the right side, the right ventricle, right atrium, you have SVC and IVC. So it's going into the jugular vein. And that is why you will have raised JVP, right? So raised JVP, and that is why the correct answer here is going to be JVP of 12 mm, 8 to 10 is normal. So this is raised JVP is what you are going to see in a right heart failure. Is this clear with everyone? So the answer here is going to be jugular venous pressure of 12 millimeters of mercury. Okay, this is going to be the answer here. Where do you see a bifid carotid pulse? So bifid basically in the systole, here you are seeing two peaks. This is going to be aortic regurgitation, right? Aortic regurgitation may be coupled with aortic stenosis as well. Then you have carotid bruit, best heard at the carotid